Good evening, good afternoon rather, and welcome. This is COVID-19 update on MITV. I am Tomi Singh Ujo, and I start out this afternoon with the news from the local scene. The Presidential Task Force on COVID-19 has received 792 million naira from various donors to assist ongoing efforts to tackle the COVID-19 pandemic. The cash donations are separated from non-cash donations made by the several individuals and groups. Chairman of the task force, Boss Mustafa, and Secretary to the Government of the Federation, made this known during the briefing on Friday. He said donations from individuals, development partners, religious bodies, and corporate groups have been credited into the Treasury single account, the TSA. For effective coordination and accountability, the Office of the Accountant General published 5 bank accounts into which donations could be paid and swept into CBN TSA accounts daily. Mustafa also commended the effort of Nigerians in fighting the ongoing pandemic, while also confirming that they do not have access to the funds donated by separate individuals. A team of engineers at the Ahmadu Bello University Abu Zaria has unveiled a locally invented ventilator to enhance the fight against COVID-19 in Nigeria. Professor Mohammed Sani Salau, Director, Equipment, Maintenance and Development Center, Abu, said these are the unveiling of the equipment at the university in Zaria on Friday. Salau, who is also the team leader and acting dean, Faculty of Physical Sciences, told newsmen that the university has made a breakthrough and working towards safeguarding the innovation of the product. He added that the university was in the process of getting the needed equipment to produce more ventilators as part of its academic research contribution in the fight against COVID-19 pandemic in Nigeria. The team leader also said they had received all the necessary support from the appropriate authorities. No fewer than 15 COVID-19 patients who have tested positive on Friday attempted to escape from the isolation center at Sobi Special Hospital in Ilorin. Saturday reliably guarded that patients jumped over the fence of the hospital to escape from the isolation center. It, however, took some hours for the security officers who launched their network around the area before they could be rearrested and returned to the isolation center. About 15 of them attempted to escape from the isolation center this morning, as security officers have been able to get all of them back. The Chief Press Secretary to the Governor and spokesman of COVID-19 Technical Committee in the state, Rafiu Ajakaye, confirmed the incident in a press statement issued last night. That's the news from the local scene. Over now to the foreign scene. I start out with a story from Brazil. The coronavirus pandemic has hit 38 indigenous groups in Brazil, raising fears for population that have a history of being decimated by outside diseases. The Brazilian Indigenous Peoples Association, APIB, said on Friday. The virus is reaching indigenous territories across Brazil with frightening speed. The APIB survey found 446 cases of new coronavirus and 92 deaths among affected groups, mainly in the Brazilian Amazon. The grim news came a day after the indigenous community of Parque das Tribos outside the northern city of Manaus held a funeral for its chief, Messias Kokoma, who died of COVID-19. Kokama was 53 years at the time of his death and was buried in a closed casket wrapped in plastic to avoid spreading the disease. Brazil, the Latin American country hit hardest in the pandemic, has seen its death toll spiral in recent times. It has registered nearly 15,000 deaths and 220,000 cases so far, though experts say under-testing means the real figures could be 15 times higher or more. A growing wave of demonstrations in Germany by conspiracy theorists, extremists and anti-vaxxers has alarmed even the Chancellor Angela Merkel. Initially starting as a handful of protesters decrying tough restrictions on public life to halt transmission of the coronavirus, the protests have swelled in recent weeks to gathering of thousands in major German cities. Thousands are said to mass again in Stuttgart, Munich and Berlin on Saturday, with police out in force after some protests turned violent. The growing demonstrations have sparked comparison to anti-Muslim Pegida marches at the height of Europe's refugee crisis in 2015, raising questions over whether the strong support that Merkel is currently enjoying due to a handling of the virus crisis could evaporate. This is caused from anger over the lockdown measures to a purported vaccine plan by Bill Gates. And lastly on the news, packed mugs, bodies in wards and patients forced to share beds and medical workers run ragged. Mumbai's war against the coronavirus has pushed the Indian city hospitals to a breaking point. One of the young men who spoke to the media over there, Ravi, had to change his mother's diapers himself as she lay dying from the disease in the huge Lokmanya Tilak Municipal General Hospital, better known as Sian. They won't just give them medicines and leave, Ravi said, and said the staff in the 1,300-bed facility were overworked and tired, with sometimes 3 patients per bed. Now he too has contracted the virus and is in another hospital, but only after 4 facilities refused to admit him. They don't have the infrastructure for the disease, he confirmed, and the state-run Sian Hospital has become a byword for the stunning failure of Mumbai, home to billionaires, Bollywood and slums to cope with the pandemic. A video widely shared on social media and shown on Indian television showed corpses wrapped in black plastic left on beds in the wards where patients are still being treated. Authorities have said they are investigating the footage. That's it on the news on COVID-19 update. We take a break and come back for more stories. We'll be back. Welcome back. As the whole world continues to ravage or battle with the pandemic coronavirus, it is important for us to take note of the countries who are suffering the most and who have discharged the most patients. Today, we're looking at the first 10 countries across the world, as we would also be looking at the most countries who have tested in Africa and, of course, around the world, focusing on Europe, the Americas, and Africa. I'll take a look from the beginning of this case. Coronavirus cases across the world has hit 4,649,079 cases, and the total number of deaths has also risen above the 300,000 mark, and we have now 309,047 deaths that have been recorded globally. But also, the number of recovered patients have also increased. The number of recovered patients has risen to 1,771,799 people. And that's good news because people have totally recovered from coronavirus. It's been said that many countries are looking, especially in the UK, at testing for antibodies to see if some people can be issued a certificate to say they will not even be infected at all. Now, taking a look at what we have, still the number of terminal cases across the world, 2% of the total active cases, which is 2,568,233 as the number of active cases. 2% of that are in very critical condition. That number comes to 45,053, while just 98% of that number are in mild condition, which means their condition is not critical at all. The total number of people in mild condition are 2,523,180. Now, taking a look at the top 10 countries across the world, we must note that the top country when it comes to the number of cases versus the number of tests that have been conducted is the United States. The United States has also tested over 1,068,305 people and have recorded about 1,484,579. Pardon me. The United States has tested, 11,090,900 people. Now, 90,900 people, 11,090,900 people is what the United States has tested, and they have recorded 1,000,000 484,579. Now, the United States has also recovered, treated and successfully managed 327,751 patients, and they still have 1,068,305 people in isolation. So I'll quickly run through the numbers of the top 10 countries with the highest number of cases in the world. The number one is the United States. Spain at number two has 274,367 cases. Russia takes the number three position with 272,043 cases. UK takes the number four position with 236,711 cases. Italy takes the number four position with 236,711. Italy takes number five position with 228,805 cases. Brazil takes number six, 220,291 confirmed cases of COVID-19. France at number seven has recorded 179,506 cases. Germany at number eight has recorded 175,699 cases. Turkey at number nine has recorded 146,457 cases. And Iran at number 10 has recorded 118,392. Taking a look at the number of tests that have been conducted worldwide, across the world, the countries with the highest number of tests that have been conducted stands at the United States with the topmost figure, 11,090,900 tests taken. Russia takes number two position with 6,656,340 tests. And of course, Germany takes number three position with 3,147,771. Now, the third of that number is the number four across the world is Spain. Spain has tested 3,037,840 people, while UK takes number four position, or I think it's Italy takes number four position with 2,875,680 cases. UK takes number five at 2,353,078 tests that have been conducted. Of course, India, one of the highest figures across the world, although at number 11, has tested 2,134,000 people, 277. Now we have other countries like France. France has tested 1,384,633, while Turkey has tested 1,574,389. Now, these are the countries across the world that have tested the most people, and they all have their cases in the tune of hundreds of thousands. The lowest of them, except the fact that India, even though is number four on the number of countries that has tested the most across the world, India takes number five position. India has only recorded 86,595 cases and has tested well over 2,141,000 people for COVID-19. But India currently has a crisis with the issue of medical supply beds, medical workers, health workers, and of course they do not even have the facility to keep people in isolation any longer. Their morgues are full, their hospitals are full, and the health workers are completely tired. Now, that is the top 10 cases across the world. Countries who have tested, countries who have recorded the most. Let's take a look at Africa. What has happened so far in Africa? Very close to home here is South Africa, that has continued to rise consistently. South Africa went into another lockdown, and the president actually had to release another set of policemen. Over 70,000 policemen were released to enforce the lockdown again, because most of the people were not totally compliant with the instructions of the lockdown. But while the beginning of the extension of the lockdown in South Africa, the president had to release more policemen, more security officers to man the streets, and of course to ensure complete compliance with the order. Despite that, in Africa, South Africa still takes the number one position with the first and the highest number of tests conducted and the highest number of cases. Now, South Africa has conducted 421,000 555 tests and has only recorded 13,524 cases. Now that shows us that they have the highest number in Africa, but the truth is they also have done the most tests in Africa. They've recorded one of the highest figures in Africa when it comes to recoveries as well. South Africa, with their 13,524 people, have also been able to discharge close to half of that number. They've discharged over 6,083 people who have recovered completely from COVID-19 and still have 7,194 of those people in their isolation centers scattered all over South Africa. At number 2 position in Africa is Egypt. Now, we must remember that at the beginning of the COVID-19 crisis in Africa, Egypt was one of the first countries to record the first set of cases. And since Egypt recorded these cases, it was important for them to go into isolation. Now, with Egypt recording the number of cases that they have today, standing at 11,228, it has shown that Egypt has, as a result of what has happened so far, tested 135,000 people. Now, 135,000 people have been tested in Egypt, but they've only recorded 11,228 cases. One thing to note about Egypt as well is even though they've recorded a high number of cases, they've also recorded a high number of deaths. The highest number of deaths in Africa is from Egypt, and that's at 592,000 people have died from COVID-19 in Africa. That's in Egypt as well. 2,799 people have recovered, but they still have well over 7,800 people in their different isolation centers scattered all over Egypt. These people are still very much recovering from COVID-19. At the beginning of the crisis in Africa, Egypt was one of the first set of countries, to record the crisis. They started on the 14th of February 2020, and as of the 1st of May, they have almost doubled that figure. There have been over 5,000 cases in just that space of time, but right now they have recorded well over 10,000 at 11,228. Now, the disease has lasted in Egypt for 3 months and 2 days. Today started on the 14th of February. That was on Valentine's Day, and all the way till today. It has taken 26 governorates in Egypt, meaning about states, the way we have states in Nigeria. They have what they call the governorates in Egypt, and it has occupied the whole of 26 states. Now, the timeline for Egypt is that they've been recovering steadily, have a high rate of cases consistently till date. Now, the cases have so far, continued to spread, and the rate at which it is spread is becoming very alarming for even Egypt to cope with. Let's take a look at number 3 in Africa. Number 3 in Africa still remains one of the biggest countries that we have in the North Africa, and that's Morocco. Morocco has recorded 6,681 cases of COVID-19. Now, the interesting part about Morocco is that Morocco has also tested 84,095 people for COVID-19. So despite the fact that they are recording a high number, they've also tested a very high number of people. 84,000 is what they've tested, and they have 6,681 cases. Beautiful thing about Morocco as well is they have also been able to discharge over half of the total number of cases that they've recorded in Morocco. 3,475 people have been discharged and declared free from COVID-19, while 3,014 people are still very much in the different isolation centers. Number 4 on our list is Algeria. Algeria has totally recorded 6,629 cases of COVID-19. But interestingly, Algeria has only tested 6,500 people for COVID-19. Very strange. They've recorded more cases than they've tested. Our cases have just presented itself, but they have only tested, according to the record, 6,500 people, although they've recorded a much higher number of that in terms of cases. 6,681 cases. They've also been able to record 192 deaths. But another good thing about Morocco is that Morocco has discharged more than half of the people, about Algeria rather, is that Algeria has discharged more than half of the people that have been confirmed positive for COVID-19. So 3,271 people are totally recovered in Morocco, in Algeria, pardon me, from COVID-19, while they still have 2,822 who are still recovering from the disease. And number 5 on our list, of course, it's always very interesting that you know that Nigeria has still not gotten to that number 5 position. Nigeria is still number 6 in Africa with the number of cases, but Ghana is still leading, in West Africa. Ghana has 5,638 cases. They've recorded only 28 deaths. Very, very interesting that it looks as if the recovery rate in Ghana has also doubled overnight, because they've only been able to do about 500 people in recent times. But as of today, they've been able to churn out 1,460 people who have totally recovered from COVID-19. Now, 4,150 people are still very much in the isolation centers. But Ghana has done well for itself in testing, as they have tested 171,642 people who have totally, recovered from COVID-19. And that brings me to our very own country here, Nigeria. Nigeria, as of today, has recorded well over 5,400 cases. The total number of cases recorded in Nigeria, according to the NCDC's report of last night, delivered 14 hours ago, is that was about 15th of May. That was 5,445 cases of COVID-19 has been confirmed in Nigeria. Now, Nigeria also has been able to, test 30,657 people. 30,657 people. Interesting to note that Nigeria has also been able, the global record says that Nigeria's cases has risen by another 5, and Nigeria's cases has risen to 5,450, rather than what we had last night of 5,445. That's going to continue to update as the NCDC gives their report overnight. Now, we've recorded 171 deaths. We have been able to discharge 1,320 people. It's quite interesting that Nigeria so far has been able to save much more people. We have 3,573 people in isolation, according to the report that we have as at now. Now, 31 people are very critical of that number, while 988 people are in mild condition. Now, with Nigeria having this kind of record, Nigeria has only been able to test 30,000 people from COVID-19. That's 30,000 people, 39,000, if I'm correct. Yeah, I have 30,657 people have been tested for COVID-19 as of now. That's 32,000 of there. 942 people have been tested for COVID-19. But the result again has been updated according to the world record that we have, and that says that Nigeria has done more than what we have on the screen right now, which means the testing capacity of Nigeria has actually increased. Now, if the testing capacity is increased, it also shows that the number of cases will also increase as well, which brings me to the breakdown of today's cases according to the NCDC. We'll be back after now. Welcome back. It's still COVID-19 updates on MITV. Let's take a look at the breakdown of the numbers for today. Lagos as the epicenter of the disease has over 2 million or 2,000, pardon me please, 2,278 cases of COVID-19. That is a very, very high figure. Lagos has 2,278 cases of COVID-19, while Kano, the second epicenter for the north, has 761 cases. And you can look at the breakdown as it is displayed on the screen. The last numbers that you have there is 36 states plus the FCT, making it 35 there. What you have is Anambra with the lowest number of cases. Anambra has recorded 2, Abia has recorded 2, Benue has 4, Bayelsa has 6, Imo has 7, and Ebonyi has 9. Those are the lowest numbers across Nigeria, where you have the highest numbers with Lagos, Kano, the FCT, Katsina, Bauchi, Borno, all of them having well over 200 cases of COVID-19. Of course, Lagos took the highest share last night with 179 confirmed cases of COVID-19. Just overnight, Nigeria recorded 288 cases. Lagos had 179 of that. Kaduna took 20. 15 went to Katsina, 15 to Jigawa. Borno had 13, 11 Ogun, Kano 8, 7 to the FCT, 4 in Niger, 4 in Ekiti, 3 in Oyo, 3 in Delta. Bauchi has 3, Kwara 2, and Edo finally 1 case. That's the breakdown of the number of cases as announced by the NCDC yesterday. The situation report for COVID-19 for the 15th of May 2020 as released just about 14 hours ago. Back in the studio here, we must say that as Ekiti recorded the 4 cases yesterday, it was announced by the Commissioner for Health in Ekiti State. Let's listen to that report.
New patients.
People will be coming out. And those areas that you find people coming together needs to be fumigated as soon as they leave the place. That is why we are going back to refumigate most of these places. If it were to be a total lockdown, we wouldn't have seen the necessity for this exercise. Addressing this pandemic issue, we are also we are preparing for this flood because we are about assessing the new MAP facilities. The new MAP is an agency that is out to assist states that are prone to flood with finance. And so we are assessing their facilities, and before you know it, you will see most of the contractors that we have assigned for this job moving to sites to do the needful.
Now, in Oyo State, you'll actually discharged about 11 patients from COVID-19 just yesterday. And the patients were discharged from the Infectious Disease Center at Olodo near the Ibadan, Oyo State, after receiving their second negative test result. Coordinator of the Oyo State Isolation and Treatment Centers, Temitope Alunge, disclosed this while discharging the patients. Alunge said the number of persons discharged was the highest at the time since the Olodo Center has been discharging patients, and said that they were discharged were 8 males and 3 females and have stayed at the isolation center for between 5 days and 2 weeks. Alunge said all the 11 patients discharged were asymptomatic all through the period of their treatment at the center. He, however, said there are still 32 active cases in the state, saying they're all in stable condition. Let's listen to Alunge.
Went to go and do a voluntary test. So after 9 days, they just called me. They just called me that I'm positive, that I need to come to the isolation center to come and quarantine myself. I don't have any symptoms since I was here. People that we are together, they are asymptomatic.
Most times they have the antibiotic parenterally, and we've had to get the antibiotic regimen based on the community study of pneumonia. The remaining 32 are very stable. We only have one of them who has a comorbid issue. Everybody's fine. We even have a family here, father, mother, and children, and they're doing exceptionally well.
Back here again, the Ekiti state government did fumigate the entire public places just yesterday in a bid to ensure that as they are discharging patients, they are also keeping the entire environment safe. The machinery for that was distributed to them by the Oni of Ife, Oba Adewusi himself, Ogusi Ojaja II, who decided to contribute his own quota to the fight against COVID-19 by distributing Nigerian-built fumigation machines to almost all the state governments in the southwest. The Lagos state government has been able to get theirs, and also Ekiti state government is putting theirs to great use by fumigating markets, public places, and a lot of other places.
It's a thing that we need to do. In fact, during this time that we are trying to ease the restriction, people will be coming out. And those areas that you find people coming together needs to be fumigated as soon as they leave the place. That is why we are going back to refumigate most of these places. If it were to be a total lockdown, we wouldn't have seen the necessity for this exercise. Addressing this pandemic issue, we are preparing for this flood because we are about assessing the new MAP facilities. The new MAP is an agency that is out to assist states that are prone to flood with finance. And so we are assessing their facilities, and before you know it, you will see most of the contractors that we have assigned for this job moving to sites to do the needful.
Welcome back from Ekiti State. We hope that the fight against COVID-19, people will continue to contribute their quota, because it seems the government is doing their best, but the people, are they really contributing their own quota to what has been happening across board? The issue of being able to use your mask wherever you're going out of your private homes has become a thing that the government needs to enforce by some means. And it was discovered that over 1,000 people were arrested in Nasarawa just yesterday, just because they couldn't obey the lockdown measures put in place by the government. People have continued to disobey the order of government, forgetting some of these measures were put in place for our own health and to ensure that we can quickly flatten the curve of COVID-19 in Nigeria. We'll talk more about what Nigeria has done to battle COVID-19, how have we fared really when it comes to testing, and all of that after this break.
doing to keep safe from the coronavirus?
I have to stay at my house and wash my hands. I have to stay at my house.
Staying home can help keep you safe from getting the virus.
And wash my hands.
Yep, you should always wash your hands with soap and water to stay healthy. Wash your hands for at least 20 seconds, or you can sing happy birthday 2 times. Those are some great tips, Musa. Hey, Musa, what are you doing to keep safe from the coronavirus?
I have to stay at my house and wash my hands. I have to stay at my house.
Staying home can help keep you safe from getting the virus.
And wash my hands.
Yep, you should always wash your hands with soap and water to stay healthy. Wash your hands for at least 20 seconds, or you can sing happy birthday 2 times. Those are some great tips, Musa. Hello friends, it's Wazi here. Do you know why we need to stay at home right now? There's a new virus in town that's making everyone sick. It can make you a little bit sick or very sick. To make sure less people get the virus, we all need to stay at home. If we all stay in our homes, then the virus can't spread. So stay home and stay safe. See you later.
Welcome back to the COVID-19 update. Joining us is Areola Dende Areyo, and we're talking about Nigeria's capacity for testing. How have we really fared? Good afternoon, Are. How are you today?
Good afternoon. I'm fine. Are you?
I'm very well. It looks as if the curfew plus the lack of lockdown and the staying in one place for so long is beginning to get to you. Are you exercising
well,
that?
Sleeping. I mean, as if I'll be sleeping for Olympics.
It's as if you're doing a sleeping competition. Am I correct?
For Olympics, yes.
For Olympics, wow. I can imagine.
Yes.
I can imagine. How have you been coping? Let's start from there.
Well, I did an online course on network marketing.
Okay.
I've finished the first level. I'm on the second level now.
Okay.
So I'm learning a new skill, which I think may come to bear on my life subsequently, because as we're talking ahead of when the lockdown will be removed completely, so many people who think they have jobs now will come out jobless.
That's
So
serious.
and as we move on, because living a life will never be the same again.
Our lives
So
will never be
for
the
those
same.
Yes, for those who really know what to do, you will need an extra skill or capability to tide you over. Okay?
At a
So
time like
ahead
this.
of all of that, that's what I've done to keep myself busy.
All right, Are, we want to take a look at how we are fared when it comes to testing. And Nigeria, I'd like to start from the other parts of the world. The United States has done about 11 million tests, and they have recorded about 1,485,590 cases. Now, the big countries across the world, we're talking about the rich countries, the ones who are the global powers, like the UK, Germany, Italy, and the rest of them. All of them have tested just, say, the top 6, starting with that. Russia, surprisingly, has the highest, number 3 is highest in the world now when it comes to number 3 in terms of number of cases. Just immediately after Spain, the United States takes number 1, Spain takes number 2, and Russia takes number 3 position. When it comes to testing, Russia is number 2 in the world because Russia has tested 6 million people for COVID-19. 6,656,000 people. But let's come down to Africa. South Africa has the highest number here, and South Africa has tested, just say, a little bit above the number, the normal number of cases that the rest of the world have tested. South Africa has recorded 11,000 cases. That's the highest in Africa. And South Africa has tested right now 421,555. That's for South Africa. The next on the list is Egypt. And Egypt has the highest number of the second highest number of cases in Africa. Egypt has tested, as of now, has 11,288 cases, but has tested 741,145 people. That's South Africa, that's South Korea. They've tested 135,000 people for COVID-19. Comes all the way to what they've done in Ghana. Ghana at number 5 today. Ghana had the case a few weeks before we did, yes. But Ghana has tested 171,642 people. Okay? And Nigeria at number 6 has tested 32,000 plus a little bit above that number of people, even though we've only recorded 5,450 cases.
Well, can I talk now?
Yes, please, go ahead.
Oh, okay. You see, what you have seen here is a systemic failure that has trailed us over the years, and pretentiously we've all been assuming that God will take control, it's not our portion, or we will work through it. If there's a correlation between the number of people tested and the number of the infected people. Now, out of 200 million people, over 8 weeks after this thing first hit us, we're still talking of 30,000. It's unfortunate. I remember when they said they will wrap up the figures, we will be doing 5,000 tests per day. At the time, they said we'll be doing 10,000 tests per day. And then somebody later said, oh, before July, we will have done over 120,000. Is it at this snail speed that we will achieve that? What this is telling me is that our no figure of 5,000 infected people is directly proportional to the low number of tests that we have conducted. We are in the band of people crying, nations crying and saying there are not enough test kits. Those who are testing in millions, were they bringing their test kits from heaven? Because I think it's a lot easier to get the testing kits, quickly identify those already infected, get them isolated towards being treated, as against under testing, while allowing those already infected and who didn't know and who are still asymptomatic from infecting more people, thereby endangering the lives of others, knowingly or unknowingly. So on this note, I'm going to score the government, NCDC and whatever very, very poorly. They haven't done too well. It can't be for lack of funds. No. We've borrowed money from IMF over this COVID-19 thing. There has been so much of a massive donation from corporate and private individuals.
Which, of course, they don't have direct access to, but they can request for the purpose of getting more test kits.
Exactly. We've gotten money from EU, from all over the world. So what then can we say is our challenge?
But despite
the US said they were not getting. Sorry.
Let me quickly cut your thought a bit. Even though we are testing at this very slow speed, we seem to be recording cases in the hundreds. Lagos over 175 cases just overnight, 288 cases in Nigeria. Are you saying that if we test massively, say 5,000 per day, we possibly will be recording in thousands? Is that what you're saying?
When you look at the figures from other nations where they've had massive testing, it will show you that the more you test, the more you discover the higher number of people infected. I can tell you today, if we start testing and say 5,000 per day, you will be shocked that we will be getting people in their large numbers too already infected. And let me tell you, as we are talking now,
Yes.
some people who are infected who do not know because they've not been tested.
Yes.
Some are, well, possibly now, let me put it that way, undergoing home remedies.
Therapy.
Some will get out of it, some will not get out of it.
And infect many
But
other
they just
people.
die. And when they die, not all deaths are recorded here anyway.
Definitely.
COVID or no COVID. The same way, not all births are recorded. So whatever figures they are throwing up from Abuja will now become inexact. Will not be correct. So I would rather they focus more. Whatever magic other countries are putting on, and they getting test kits, we too should copy them and get the test kits. There was someone I read 2 days ago that they're coming up with kits that can refill within a few hours.
Yes, the rapid test
Without
kits,
having
yes.
to wait for days. So why can't we quickly get at that and get it down here? Yes, we are so quick in getting Madagascar solution. Why don't we just, with the same speed, go ahead and get the test kits? The test kits are far more important than solution, if you ask me.
Let's
With
look
the
at
test kit, we will know how many more of our people are out there already infected and who do not know. And their lives are ebbing away.
let's look at the testing versus the lockdown measures and the curfew. Is it going to affect, do you think if we conduct more tests, we are likely to come out of whether it's going to be the lockdown or the curfew, as quickly as possible? Does it have a direct impact on how quickly we are able to settle down as a country?
This may come out as very hard punch to accept. The lockdown has failed us to the extent that people are now saying, if I will die, let me die. That they're going to hang back in their homes and allow hunger, starvation, kwashoko to come and kill them in their homes. In Yoruba land, they say when you tie a goat somewhere, you provide that goat with cassava peels to eat. So you don't just say people should hang back in their homes and not go out. People are back on the streets in their large numbers. So I don't want to surrender or subscribe to the idea that lockdown is doing magic. No, it's not doing any magic. Let's increase our testing capability, then we can be talking.
But even if
we begin to test, yes, in large numbers,
Yes.
we'll be getting infected people results in large numbers too.
But Nigerians are not even willing to stay back for treatment. For example, 15 people did escape from an isolation center, I think in Boda area of Ilorin or Kwara State, just yesterday.
Okay.
And they had to be caught to bring them back. Asymptomatic people are taken into isolation and they believe that they have no business being there. So even if you get them into isolation, if you get them tested and positive, are they going to agree when many are trying to escape?
Let me tell you why. Everything boils down to the mere fact that there's a huge disconnect between the government and the governed at all levels and across length and breadth of Nigeria.
Okay.
Look, apart from Lagos, most of other states' isolation centers are nothing to be reading home about. Now, these people are afraid of surrendering their lives into the hands of people who, for all they could see, may not take very good care of them.
Okay.
Yes, FCT also has fantastic isolation centers.
Okay.
So what because somebody that I spoke with said, instead of allowing yourself to be so isolated and end up wasting away, they would rather isolate. You know what that means? Pretend to be isolated. We call it isolation. Yes, that they would rather isolate and go take care of themselves, believing that either at the isolation center or wherever they may be, their hands are in their lives are in the hands of God.
Yes.
So government still also have to, I have said this several times, they need to buy the confidence of the people.
Okay.
People must trust the government. They must believe the government. And we've been saying this before this thing now came. And this has now shown the underbelly of the government,
Okay.
which again has made the people not to see that they are safe with the government. It's like saying when you see a snake and you see a policeman, as of those days, My son is an armed and a policeman. Who do you go to? Okay? So we told the police to change the narrative by their behavior and public conduct. Of course, they began to do that. So government too has to begin to let people believe them. Let people believe, to have confidence in what they tell us. And the only way to do that is to give us quality governance. Outside of that, it is not going to gel.
Thank you very much, Ariola Dendiario, for bringing it home for us this evening. Once again, I say enjoy the lockdown. If they decide to lock us down again,
Are you enjoying lockdown yourself?
I'm not even sure which one I should pick, because at the level of the lockdown, I couldn't buy anything and I had to cope, but I was at work. And after the lockdown, during the curfew, I can't drive a 10-minute distance without spending 1.5 hours on the road. So I think it's the same for me, the same measure of suffering. So the quicker we get out of this issue, as it were, the best for everybody.
Maybe I should let you know, I have stopped all TV and radio appearances. Why? The pain of driving down and back to your house has now outweighed whatever value you want to add.
Wow.
That's why we are on phone now.
Yes.
Your station is not too far away from my house, but I can't take the risk of being on the road for 3 hours and then getting back again for another 3 hours. You know? So government really have to do something. They must rework the architecture as far as this environment is concerned. It's not working for anybody.
It's not working. It's not working. Thank you very much, Are, and have a beautiful evening. We've been speaking with Ariola Dendiario and on telephone as well, and we've been trying to find out if Nigeria has really done its best in tackling the issue of COVID-19, testing particularly in focus. If we look at the number of cases that we've tested at 32,000, as at today, over 32,000 people have been tested for COVID-19 for us to record 5,445 according to the government, and the global figure saying we have now done 5,450 confirmed cases of COVID-19. It means that we may need to increase the testing as quickly as possible, according to Ariola Dendiario, to ensure that Nigeria gets that balance and that quick curve that we're trying to flatten as quickly as possible. But takes me to the issue of churches that are wanting to quickly reopen, or mosques that are quickly wanting to reopen. A close family member told me just a couple of days ago that a church pastor in the United States did die in Philadelphia from COVID-19. It brings to total number of deaths around that area, pastors that have died, to about 30 pastors that lost their lives as a result of COVID-19 at one point or the other, and tells us that the issue of gathering together in cluster is not a good issue for now. We need to, as much as possible, maintain that social distancing. Social distancing for me means socially distance yourself in terms of when you want to greet people. You don't have to do the hugging, the kissing like we used to do. You can just greet them from afar. A wave from afar will do you some good. Some elbow greeting from afar will do you some good. Or you go with the traditional way of greeting, squat or bend or prostrate or kneel down, whatever you need to put in place to greet. Just greet and make sure you're socially distancing yourself from other people. Another thing we need to learn to do, Lagos State government is doing the Mask Up Lagos, and they're taking it seriously. So there are banners all over the place, there are adverts all over the place, car banners are going about, and they're saying, use your face mask. Now, you want to buy food, cover yourself just as the person in front of you is also covered. You need to do that critically every time you want to step out of your comfort zone to ensure that you are protected and the person you're speaking to is as well protected. And when you touch surfaces at tables, door handles, whenever you step out of your comfort zone, you need to do all you can to keep yourself safe by washing your hands with soap and water the moment you get out of that place, or use a hand sanitizer if you are not close to a wash basin where you can wash your hands. Ultimately, it is your responsibility to keep yourself safe. It is your responsibility to keep yourself home if you do not have anything to do outside of your immediate environment. That's it on COVID-19 update for this afternoon. I am Tomi Siojo. Remember that if you're sick, you can call the Lagos State government or tweet at the Lagos State government. That's follow LASG on Twitter, or you call any of the numbers and you let them know that you are sick. Malaria, whatever kind of sickness, or you are due for delivery, you're pregnant, you're due for delivery, you can call the Lagos State government and they'll send an ambulance to pick you up and take you to the nearest hospital. Have a beautiful afternoon. See you again in the evening on the news.